I've been receiving a lot of messages on social media about a problem that's actually widespread in society, especially among young people who are 16 years old, 17 years old, and it's even more common among older people over the age of 60, which is general fatigue. Today in this video, I'm going to talk about the causes of general fatigue, how we can diagnose it, and how we can treat it. So you can learn more about this common topic. Stay with me until the end of the video. If this is your first time on my channel, I'm Dr. Ehsan Kadan, an internal medicine physician at Boston University Hospital, and today in this video, I'm going to talk about 5 or 6 causes of general fatigue. One of the most common causes in our community is anemia. In fact, anemia has many causes. We have iron deficiency anemia, vitamin B12 deficiency anemia, or folic acid deficiency anemia, or sometimes as a result of ongoing chronic bleeding over time. We especially see this symptom in women in their 20s and 30s due to the bleeding that occurs during menstruation. Because of this bleeding, the body is unable to compensate for the lost blood or produce new red blood cells due to the decreased iron stores in the body. And if the body is not getting enough iron, it can't keep up with replacing the blood it loses, and as a result, we develop anemia. In fact, detecting this condition is very easy. You can go to the doctor, and the doctor can do a CBC test or a hemoglobin test for you. So if its level is low, for example, less than 10 or 9, you will experience symptoms more severely than if it is just low at 12 or 11. The most important of these symptoms is general fatigue and being unable to carry out daily tasks like cleaning, cooking, or even walking or climbing stairs. You might also feel dizzy just from standing up quickly. You might also notice that the patient looks pale or even that their hair may start to fall out. The second issue is hypothyroidism. As you know, the thyroid gland is located in the neck, and sometimes, for various reasons, this gland can become underactive. Sometimes the cause is within the thyroid gland itself, or it could be due to the pituitary gland located in the head. The pituitary gland acts like a maestro, sending signals or hormones to the other glands in the body, and these hormones help stimulate those glands. Sometimes there can be a deficiency or weakness in the activity of the pituitary gland, which in turn leads to decreased activity in the other glands. Along with general fatigue, a patient with hypothyroidism may experience weight gain, their hair may become fine and could fall out, and they may develop a kind of lethargy and intolerance to temperature changes. Meaning the patient might say that they feel cold or hot, while the people around them in the same room might say that the room temperature is perfectly normal. They may also suffer from digestive symptoms such as constipation. In fact, detecting hypothyroidism is very easy and is done through a TSH hormone test. And if you go to the doctor and tell them you have these kinds of symptoms, it can help you get checked for this condition.